You're watching the award-winning GHS TV, a nationally recognized student television station.
Hello and welcome to Conversations. I'm Betty Lamar and we are live at AM Diabetes and Endocrinology Center. Now, a lot of you all ask me about nurses. Betty, why don't you talk more about the role that nurses play in a healthcare setting? So we're setting this series off with my very special guest today, Miss Laura Scott, and she is a nurse manager. Hi, Laura. Welcome to Conversations.
Hi, Betty. Thank you for having me. So yes, I'm Laura Scott. I am a nurse leader. I manage 5 different departments within the hospital setting. It's approximately about 60 people, nurses, nursing assistants, and techs, all within the perioperative services. Okay, so
what is it?
Perioperative services.
Yeah, see, that's why we need nurses. Okay, we only know about that if we've had to deal with that, and I'm pretty sure I have. So break that down. What exactly is that?
So that's in and around surgery, operative services. So we get them ready. We do pre-admission testing, where that's a week before the surgery. We get all your lab work, all diagnostics, and get all our T's crossed and I's dotted to get you ready for surgery. The same-day surgery department is where we do the final checkpoints to any day of labs that we need, anything necessary to get you ready for surgery. We get everything taken care of. We also discharge patients from there as well. Pre-op holding is another department that I manage, and that's where we do a lot of anesthesia procedures, anesthetic blocks and such things. And then I also manage outpatient services, which is infusions, transfusions, and injections. Different little procedures and intravesical treatments as well for cancer. And then endoscopy suite, where we do GI procedures and pulmonary procedures as well.
Okay, now you already know that we have to unpack all of that, right?
That was a lot.
Okay, so now, all right, I'm the patient. Okay, I'm the patient, which I do have to have a shoulder replacement. I'm running from it like I'm running from what? A pit bull. That's how fast I'm running.
Got it.
But I know it's inevitable, okay?
Yeah.
So, okay, we're just gonna play this out, okay? What is the first thing when you meet me? What is one of the first things that you're gonna have to deal with when I said, oh, okay, I'm Betty Lamar, you know I'm here for this, because you already know. So what does that look like? You're talking to me about, Betty, this is what's gonna happen to you.
So you schedule surgery with your physician in their office.
Okay.
And then you'll come to the hospital for pre-admission testing, again, about a week before your surgery. So any pertinent labs that you'll need, blood work is what I'm referring to, any, if you need any EKGs or chest x-rays, anything related to your health condition that we need to check to make sure you're safe and ready for surgery, we'll get all those diagnostic tests done at that point.
Okay, so what does I've always wanted to know this, because everybody have to do that, this blood pre-thing. What does the blood have to do with it? Is that for the purpose of just in case something, for some reason that person have to have blood? What do y'all have to do the pre-blood testing for?
So the standard blood work that we do is more about the chemistries, your electrolytes, potassium, and your levels and how you are and the safety of that and how it's going to mix with the anesthetic medications.
Okay.
So that's the standard blood test that we do, and then depending on what type of surgery, they will test of what type your blood is and have that ready in case you do need a transfusion, but not all surgeries require that.
Okay, so is it possible that a person can hide something, maybe that they're, some chemical that, like you all ask questions. Like when I go in there, I say, well, do you smoke? Do you do this? Do you do that? and of course I'm always honest because I've worked in surgery and I know I don't want them to do anything to me and end up having an adverse situation because I lied to the doctor. So can a person literally lie about something that they're taking because they don't want to reveal that?
That's a great question.
Okay.
And I'm glad you asked that. So number one, honesty is the best policy because in the healthcare setting, we are not judging. It is none of my business or any of my nurses of what you do in your free time. We're not asking because we're investigating you. We're asking because of how that can interact with the anesthetic medications that you'll receive during surgery. And they can be very serious. So it is very important to be honest about anything that we ask. We ask those for a reason.
Okay.
Now, your question to answer that whether or not we can tell, have you been lying? It depends on the type of test and the different extracurricular activities you could be involved in.
Yeah, that's what I'm talking about.
Sometimes we do tests for specific drugs and certain things like that in your system. It just depends on what your physician orders. But a lot of times we can tell.
Okay, so what is it about people, since you mentioned surgery and I work there and I've seen it all, right? So what is it about some people that it take them longer to I guess you'd say wake up or after they have surgery versus others? I always say it must be a smoker. Maybe they didn't, did they get too much anesthesia? Did they not tell the doctor what's in their system? So is there a reason why some people, it take longer to wake them up after surgery?
Yeah, I mean, everyone's, how they metabolize differently.
Okay.
Your filtration organs, the liver, kidneys, and how well they perform definitely can affect it. Your just overall health can be an indicator of that, but every human's different, so everyone reacts a little bit differently. And I'm not an anesthesiologist or a nurse, anesthetist, anything like that, but anesthesia is an art.
Okay. Now we're going to get into the nurse manager part. Okay, so what does the day look like? For a nurse manager like yourself? What does your day look like from start to finish?
So it's a little different than a traditional bedside nurse.
Okay.
I arrive to work and I check in on the departments and make sure everything's going smoothly. Just, are there any issues that I need to address? Is there anyone need assistance with anything? Any issue that I need to facilitate in correcting. So are our patients rolling to surgery on a timely manner and so forth. So that's my first and foremost thing that I do. And then once I, check on all my departments, make sure everyone's settled in, then I get to do paperwork.
Of course.
Yes.
What can we do without paperwork, right?
Absolutely, yeah. Budgetary things, productivity, just getting my T's crossed and I's dotted, and they're all just to support the department. And there's a lot of flexibility within my day because I have so many departments and it's surgery. There's a lot of different situations that can pop up that we have to handle, and so it's not as consistent as maybe some other professions, but it's always an adventure.
So are you a part of the hiring and firing? If a nurse say, like, I remember working at a particular hospital and I remember an employee was like, I guess you would say stealing drugs. And of course got caught, which was a good thing because that medicine should have been going to patients. So would you be called in if there was some kind of discrepancy with meds or anything like that, or if there was something going on with the nurses? Are you just working, are you the nurses manager, you manage your nurses, or you just manage all the departments?
Great question. Again, I do manage the nurses and the departments and the personnel within those departments. So again, it's not just nurses, it's techs and nursing assistants as well. And yes, part of that paperwork piece is doing audits and just following through and seeing, was this medication pulled out of the Omnicell, the security.
Yes.
Holding all the medication. So was this medication delivered to the patient? How much was? If there's any waste, did they document it properly? And yes, we absolutely monitor very, very closely for any diversions.
Okay, now we're going to take a break. Miss Laura Scott, and we will be back shortly, and we're going to go into more of this. I'm learning so much, and this is so good. And I know our viewers will be happy to give you, not just ladies, but we always associate nurses with females, but there's some great males as well. And hopefully we'll end up getting one of those male guys on here. But right now it's all about the girls. So I'm Betty Lamar again, and you're watching Conversations. My very special guest is nurse manager, Miss Laura Scott, and we'll be right back after this break.
You're watching the award-winning GHS TV, a nationally recognized student television station.
I'm your moderator, Brandon Sewell, coming to you live from the campus of Germantown High School.
So GHS TV tries to model a real working station.
I really thought it was cool when I first started studio and all the opportunities that it was able to provide for me.
That would be 36 out of 36. It's a rigorous class that demands a lot from students.
At times you are going to be thrown into the fire to where you're just going to have to figure it out yourself.
Which is really great because then we gain more knowledge. Our teachers will give us how to start, but then we're left to make up the whole entire process.
It just seems to me it's not enough space in the beginning. If it's not, let's figure out what we can do.
They can be a producer, they can be a director, they can work graphics and learn audio, they can go out and shoot field reports.
Akila, back to you.
And it's a challenge to throw them into the environment and say, here's a camera, go out and record this interview and some B-roll. But those are the challenges that grow students to do bigger projects.
Welcome to Red Devil Newsbeat.
In GHS TV, we have a variety of shows. We have Crosstalk.
Hello and welcome to a new season of GHS TV's award-winning talk show, Crosstalk.
We have Insider, which is all about Germantown.
Welcome to GHS Insider, the show that's all about the G.
Cut to One and Q Talent.
Wake up, Germantown. It's Wednesday, April 5th. I'm Colin Ewing.
Some things that I've learned from this class is that how to work as a team.
We learn how to communicate better with people.
Something I'll take with me from in the future is their slogan, check, double check, and check again.
There's so many different things you can do here. I would say take risks. Push yourself further than you think you can go, and we will help guide you there.
Go Red Devils!
For more information about the Kappa program, visit ghskappa.com or call 755-7775. You're watching the award-winning GHS TV, a nationally recognized student television station.
Hi, I'm Laura Scott, and we're here having a conversation with Miss Betty Lamar, and I am a nurse manager, and we're speaking to what a nurse leader or nurse manager does in the healthcare setting.
Okay, so thank you. Thank you for doing that for me. I was busy scratching. Okay, so now let me ask you this, Laura. I know sometimes in hospital, I've seen so many situations where the family, you know, we can not be very nice people sometimes. And you all come in and you do so well and you take care of the situation. So do you ever have situations where your nurses maybe have a patient or a family member? Normally it's the family member because the patient hurting. So the family member is acting all, you know, out of order. And how do you handle that?
Absolutely. You know, when you come to the hospital, and especially in my specialty areas or to our procedural areas, there's a lot of anxiety. You know, they don't know, it could be a diagnostic test that they're getting, or it could be a surgery that they're getting ready for, but there's a lot of anxiety and there's a lot of emotions built up. So yes, a lot of times patients and families themselves can get worked up, and I do absolutely have to deal with that, and I'm happy to do so. You know, there's wait times, things change, and change again makes people nervous. So, you know, I think the best thing to do is help set expectations with patients and families, and we try to do the best we can. You know, again, things change, surgery, you know, emergencies arise that can delay, you know, the schedule of your surgery and this and that. But, you know, I just try to take it from a very compassionate, empathetic position when I go to talk to families, and I want to hear what they have to say and what their experience was, and what I can do to make it better.
Okay, so let's go back to, like, say, a surgical setting. Because I worked in surgery, so I sort of, you know, see what's going in there. So will you have to be notified on those situations when, say, like, when you mentioned emergencies, delays for whatever reason? So I remember situations where there was a delay. Of course, the doctors don't like to be delayed because they're on a schedule and they need to get it done. And they would get like really upset sometimes because I was supposed to be first, so I was, you know, I didn't know I was going to be pushed way back here. I got to be. So how do you all deal with the doctors if they're not happy? Do you have to?
Yes, and again, I feel like I take the same approach.
I don't envy your task.
Well, I'm happy to do it.
Okay, all righty.
You know, they're human beings too, and they have the same anxieties. You know, they take their profession very seriously.
That's right.
And you know, they want the patient to be taken care of safely and effectively as well. And you know, you just take an empathetic approach to it and have a rational conversation with them and
okay.
They can be rational.
Yeah.
You know, and it's just working together to get the patient taken care of. We all have the same goal in mind. So at the end of the day, that's what it really comes down to, is taking care of that patient. And we always seem to work it out.
So with working with how many nurses under your leadership?
I have approximately a staff of 60.
Woo. So mostly females?
Majority, yes.
Okay, the majority females. How in the world do you keep that female energy, especially, because we call it being catty, how do you keep them, what do you call it, not happy, but under control?
I have a really good team, I have to say.
Good for you.
I inherited a good bit of them, and then I do a lot of hiring myself. And when I hire people, I have a mandatory shadow session for anyone that wants a job or that we're seriously considering as a candidate. That way they get a feel of the department, what we do, what a day looks like for them, and also who they're going to be working with.
Okay.
So their coworkers, the physicians, the other team members. So I really try to get everyone a feel of what it looks like to work in that department, because it's a huge commitment. A job is a huge commitment, and a 30-minute interview I just don't think is very sufficient.
No.
To get a real feel of what you're going to be doing.
You think whatever I want you to think in 30 minutes.
Absolutely.
But then when I'm on the job, you go like, who is Betty Lamar? Yeah. That's not the lady that I interviewed. She was so nice and kind. And now she's like a Hellcat on the unit, right?
Absolutely.
So have you ever had the unfortunate position where you had to maybe fire somebody or something like that, or not fire, but they just didn't work out?
Absolutely. That's part of the job. And to be very honest with you, the terminations that I have been facilitating, I actually feel good about those, because I'm keeping my patients safe and my team happy. So if that ever comes to a situation where I do have to terminate someone, it's a good thing for the team to separate that relationship. So I know that I'm advocating for my team and my patients, number one, and it's just a part of it.
Okay, so let's start at the beginning. I know you didn't become a nurse manager overnight. Take me back to the beginning when you first decided, oh, I want to get into nursing. Where did that start? I like to go back to see, to bring us forward.
All right, so this is my story.
Okay.
I started out as a chef. I love to cook. I had a big family, and I've always cooked dinner for them, and I just loved it. You know, Food Network 24/7.
I admire you. I can't fry an egg. Okay.
So my grandmother fell ill. And the first thing I did was just cook.
Okay.
I, researched all these nutritionally dense meals, and that's what I could do, right? That was my wheelhouse.
Okay.
And unfortunately, it didn't help. She was too sick, and she passed away, and we had a freezer full of food.
Okay.
And through that experience, I realized that was me taking care of her.
Okay.
And seeing the nurses take care of her in the hospital was inspirational to me, and that I wanted to take care of people on a higher level.
Yes.
And do more. And so I enrolled in nursing school after she had passed away, and I'm fulfilling that.
Okay, I'm sure she'll be proud of you. Well, did you originally start you're so young, but back in the day, to be an LPN was a big deal, you know, because I'm 69 now. So back then, LPNs was it. If you was an RN, it was like, wow. But now everybody is an RN. So did you originally go in as an RN when you first had your training, your studies?
I did. I went in and got an associate's degree. So that was a 2-year degree. And then I immediately enrolled into a bachelor's program. So I do have my BSN as well.
Okay.
And yeah, leadership was not on my radar, I have to say. That was not, I did not enroll in nursing school and say, I just want to manage, no.
Okay.
But I think it was a natural progression for me. I've always been a take charge personality, and I'm just a natural leader, and it just happened.
Well, good for you.
You know, I always, kind of went above and beyond while I was at work, and helping create better processes within my departments and what was in my control. And my leaders saw that in me, and they helped develop and mentor me into the role that I'm in now.
That is so wonderful. I have a sister that's a registered nurse, and really a family of not only of military, because I'm a service member, but either in my family you went into the military or some form of nursing in the medical field. So that's pretty cool. So I think that's one of the reasons I decided to do Medical Talk, because it was just a part of who I am. But what I want you to do, before we wrap up this segment, I want you to look at our viewers, and I want you to just let them know, inform them the importance of a nurse, period, and your leadership. And like, I think about when the nurses are there when the doctors are not there. So in a way, it's almost like the nurses take care of the patients, and the doctors come in and do their thing, of course, very necessary. Mm-hmm. But when they're not there, the nurses are, you all are handling it. And I just want people to know the importance of your role and what you do. So maybe some of them that want to act a little testy with you all, they will understand what you all are up against every day, and that you're there for them. And there's your camera.
Okay. So first and foremost, I think every healthcare professional, our number one goal is taking care of patients. And nurses have a very special role in that. We're with you, 12 hours straight, taking care of you, your every need. And we are constantly advocating for you. That is our number one goal, is to advocate for you and get you what you need. We're part of a team, but again, the goal is to take care of you, the patient, at some of your weakest times and your biggest time of need. And that's what we're there for, help you get better.
Yes, and I am just absolutely awed at nurses. And one thing for sure, Laura, when you've been in a hospital setting, be it you're the patient or the nurse is taking care of your loved one, I mean, you're always so happy when you get those nurses that have that natural compassion.
Yeah.
And I've had some that I would say, I wonder why did she go into nursing? But it could be because it was a bad day for her. You know, we all are, like you said earlier, we all are human beings.
Absolutely.
And we have things that we're dealing with. But to me, I see a nurse as being, as you used the word earlier, compassionate and all those things. So to me, if you're not going to be compassionate and empathetic, why choose this profession? Because you're going to have to be. You're dealing with people that maybe have just got, the doctor may have just went in and say, you got 2 hours, or you may have 6 months. So they're not happy already. And when a nurse comes in with that compassion and just being empathetic, that's what I just love about 99.9% of every nurse that I've ever had to deal with my family members, or even myself when I had to have surgery. And obviously, I guess you could say, people ask me, am I a bariatric patient? Because I have a lot of bariatric shows, because I just think it's very interesting to see people decide in their life that they want their health to be better and their life to be better. So I do a lot of shows, you know, that showcase, and a lot of patients, they showcase, you know, where I was and this is where I am. So a lot of people ask me, did you have bariatric surgery? Like I'm sort of kind of like hiding it. And I'm going to be honest with you. Sometimes I say yes. So anyway, Laura, thank you so much for being my very special guest today, setting off this series all about nurses. I like to say Nurses 101, because we're going to talk about everything that nurses do on a daily basis.
Well, thank you. I really appreciate you giving me this platform and help explain to the rest of the population out there to try to create that ease for them when they come into the hospital setting or healthcare setting. So thank you very much.
Yeah, well, you came highly recommended by a nurse. So if you're going to do this nurse thing, you need to find Miss Laura Scott, because she will be the first one that you will want to speak with, and then you take it from there. Thank you, Laura.
Thank you, Betty.
Thank you for watching Conversations with Betty Lamar. I had a wonderful conversation today with Laura Scott. Now you know what it's like to be a nurse manager. And I implore you to be very kind to your nurses, because they're doing everything possible that they can to make your stay well at the hospitals, okay? And you gotta think, you're not the only patient that nurse has to deal with on a daily basis. So be patient and be kind. Have a good day. See you next time.